So I'm doing this video for my students and also for you. And today we are focusing on the nursing management. We are managing infectious conditions. We have conditions that are highly infectious. When you look at the side of the screen, I've put for you a list of infections that are conditions that are highly infectious. And when we encounter such questions, conditions in an exam, this is the kind of management that we are going to use. Number one, we are always supposed to start with the M's. And the M number one is to isolate the patient. Okay? Patient isolation. So the first thing we are going to do when we receive anything that is infectious, we are going to isolate the patient because we do not want this condition, this infection, to spread to the other people. M number two is going to be to eradicate the causative organism. There's always something that is causing that infectious condition. It can be a virus, it can be a bacteria. So we want to eradicate it. When we isolate the patient, then we eradicate the causative organism. The third aim we are going to have is always to allay anxiety or to give emotional support or to give psychological care. Okay? Then the last aim we are going to have is to prevent complications. So in this case, you have to give an example of which complications you are trying to prevent. So you have to say to prevent complications such as you give an example of the complications. When you put your 4 M's like that, that is 4 marks on a free silver plate. Okay, then we go into the main management. So on the side of the screen, you are going to see again a management that I put for you. So we are going to have the first heading that is saying patient isolation slash environment. So we are going to handle this at once, the isolation of the patient and also the environment, because we have to consider the environment in which the patient has to be isolated. So that's going to be your heading, and you underline very well, and you're going to put in the points that are supposed to be there. What you are going to do as a nurse, what are you going to do about it when you isolate the patient? How is the environment? We are going to say, I will isolate the patient in order to prevent the spread of infection. Okay. Then when you put that point, you are going to go to the other ones that are going to talk about the environment now. So you are going to say, I will nurse the patient in a well-ventilated environment in order to promote air circulation. Okay. You can also say, I am going to nurse the patient in a noise-free environment in order to promote rest. You can also say, I'm going to nurse the patient in a clean environment in order to prevent the spread of infections. Okay? When you put at least 4 points on that heading, we are going to go to the next heading, which is disease notification. This is where we are now going to notify the general public on the presence or the disease that has come in our midst. If we are talking about cholera, once we receive the first case of cholera, we are going to notify the general public on the first case of cholera. So we are going to say disease notification, and we are going to put, that is our heading, we underline, and we say, I will notify the general public on the first case of this condition. You specify the condition in the STEM question. And why are we doing that? In order to promote awareness, okay? And the other point you can add there, you can also say, I will use social media, newspapers, public gatherings in order to reach out to a massive number of people. Just the medium you are going to use in order for you to reach out to a large number of people. Nowadays, you can use Facebook, paper, radios, TVs, etc., etc. Then you go to the other point, which is the barrier nursing. Okay, so you say barrier nursing, or you can say infection prevention. So now, how are we going to prevent this infection from spreading? That's why you're going to put in the points to say how you are going to how you are going to be washing your hands, how you are going to be telling people to social distance, how you're going to be telling people to probably cover their food, depending on the type of condition that you are being given. So here, You are just making sure or putting an emphasis to the fact that we need to prevent this thing from spreading. When you are done with that one, then we are going to go to our psychological care. You give psychological care to the patient. The psychological care, it is the same point that we've always had, and I'm glad to say I have some points running for you on the side of the screen. After psychological care, we are going to go to our observations. Observations are also basically the same points. They are the ones running on the side of the screen. Then, after that, that is the specific nursing care that we are going to have for infectious conditions. The next one we are going to have, we can follow it up with the general eprophenema. After that, we are done with the infectious conditions. Make sure to follow Louis Foundation, Louis Tuition Center on all our social media platforms and ask questions whenever you want.